All right, so you guys know that we have a guest lecturer here today. This is Miss Laura Fannin. She is a master's degree candidate, and we do support her a great deal in presenting burns, which is one of my favorite topics because it is so juicy. So I'm going to help her. If she needs anything, I'll be setting up toward the back. Let's see what else. Harold here? Harold had an announcement. Would you like to do it now, or would you like to do it later?
We can do it now. I'm good either way.
Okay. Harold needs attention. You would like to stand up front?
No, Harold.
What?
I have to count hands.
Oh, okay.
We're taking a quick look at what to do with our change board.
I don't know. Let's see. Dosage calculation 101. Can we count? Anyway.
Okay, did everybody read the email I sent out last night about the change board, the 6 charities that were submitted to us to deal with? Anybody in favor of autism awareness, raise your hand.
It's Autism Month.
That it is.
What's the truth?
Charters Hospital. Alzheimer's Association.
Did you forget to raise your hand?
St. Jude.
Raised your hand last week. Remember that.
All right.
Bad joke.
I know, right?
Lexington Humane Society.
It's pathetic. Oh, there's a lot of
UK
options.
Children's Hospital.
I think some people have wrote twice. I think people.
All right, it looks like Alzheimer's, St. Jude, and UK Children's Hospital are the top 3. So we'll divide that up and give that to them. Does anybody have any connections to somebody that prints T-shirts?
Yeah, I have a customer.
See me after class. Because we take orders for T-shirts for this semester, but the company we go through is going to charge $20 per shirt.
Yeah,
No.
that's way too much. That's like over twice.
Exactly.
They shouldn't be. They probably shouldn't be more. Depending on how many you get, probably should be more than like $6 or $7.
Yeah. See me after class and we'll work something out. Alright, then there's a basket item coming up, which Sarah will have more information on next week. Don't forget, we're still selling candy bars. Thank you.
Song of the day? Anybody? Bueller.
Bueller.
I know, right? That ages us, you know.
The Vazenga.
Do what?
The Vazenga.
Yes, I love it. I love it. All right, guys, attention, please. Oh, you look cute. I dig it. All right, so Laura has to videotape herself twice in this process, so just FYI. None of you are on the video. It's only her pretty much. And I will turn the floor over.
Thank you very much. So this is the burns unit. I'm going to have to kind of stand in this position for a while just because I've got to do the video for my project, so I won't be moving around a lot. But it's kind of an interesting topic. She says it's juicy, and that kind of grosses me out a little. But so we're going to get started. If at any point today, this morning, you all want to stop me for anything question-wise, if I get going a little too fast, if I'm not speaking loud enough, if you all are ready for a break and I haven't said something about a break, you all, this is just, we're a family here, so we're relaxed and let's just get through this together, okay? So we always start out with our student learning objectives, and I know you all can read, so I'm not going to read every single slide to you all, but these next couple are pretty important. At the end of this lecture or this talk, hopefully you all will be able to differentiate between partial and full thickness burns. I know you all have probably heard of 1st, 2nd, 3rd, and 4th degree burns. Well, we still use those terms, but there's a little more specific terminology that we're using now, so we'll go into that. Apply some tools to determine burn severity. Compare patho, clinical manifestations, complications, and collaborative management in the 3 burn phases. So we're obviously going to go over some burn phases. We're going to compare various burn wound care techniques and surgical options for partial thickness and full thickness burn wounds. Learn to prioritize nursing interventions in the management of these patients and examine physiologic and psychosocial aspects of burn rehabilitation. So we're going to start with a review of the integumentary system, which is our skin, and it has 4 structures. Number 1 is the epidermis, very thin outer layer, about as thick as a sheet of paper. Then you go down to the dermis, which is connective tissue that lies below the epidermis, which is also pretty thin. It's 1 to 4 millimeters thick, millimeters, not centimeters. It's very vascular. And then the subcutaneous tissue, which lies below the dermis, and it attaches the skin to the underlying tissues, and then skin appendages like hair, nails, and glands. So we have 4 structures. The functions of our skin are it provides a protective barrier from bacteria and viruses, prevents water loss, insulates the body, protects from trauma, sensory perception, and heat regulation. And y'all have to tell me if you like my pictures, okay? It kind of breaks it up a little, I think. So burn is an injury caused to the tissue by several different things. Heat can cause it, chemicals, electrical current, and radiation. Also, cold can cause it. Can y'all think of a burn from cold? Frostbite. Mm-hmm. Some American statistics about burns. 450,000 estimated people in America seek burn treatment per year. I thought that was a pretty significant number. About 45,000 of those people are hospitalized. About half of those hospitalizations have to go to a burn care center. And about 3,500 Americans die as a result of a burn injury per year. And this kind of makes sense to me. The highest fatality rates are less than 4 years old and over 65. Why do you think the child would be?
Since they have less skin or less area.
Okay, and the older person? Somebody louder? Thin skin. They've also got health problems that sometimes can complicate the burn injury. Kind of compounds the whole scenario. As far as global statistics, about 11 million people globally seek treatment per year for burns, and about 300,000 people die per year throughout the world. Types of burn injuries: thermal, chemical, smoke inhalation, electrical, and cold therapy. So thermal is probably your most common, caused by flame, flash, scald, or contact with a hot object. Chemical, exactly what it sounds like, acids, alkalis, organic compounds. Anybody think of a chemical burn? An example? Good. Smoke inhalation, breathing in hot air or noxious chemicals. Electrical, high and low voltage, intense heat from electrical current. And what's that going to do to your heart rate and rhythm? It's going to convert you to, it can be a lethal rhythm. Notice that's italicized, heart rate and rhythm. Just kind of be aware of that. And then cold therapy, cold burns from frostbite. So we have 3 classifications of burn injuries. We use the depth of burns, the extent of burns, and the location of burns. And we're going to go into pretty good detail with these 3. We'll start with depth. And we still do use 1st, 2nd, 3rd, and 4th degree terminology, but again, we're going to go into a little more detail. And a 1st degree is called a superficial partial thickness burn, and it just affects the epidermis. Remember the thickness of the epidermis. That's about like a piece of paper, very, very thin. So you're just going to see redness in that area. You all need to be familiar with, if I described a burn, you could immediately think in your head, well, is that a superficial, a deep, or a full thickness burn, 1st, 2nd, 3rd, and 4th degree burn. So this is just going to be, you touch the stove, ooh, it just burns a little bit, and you've got a little redness, it hurts. A lot of nerve endings there. 2nd degree is a deep partial thickness, and it affects the dermis. And remember I told you that was a very vascular area. thicker than the epidermis, painful. First and second degree burns are painful, lots of nerve endings. The third and fourth degree burns are kind of clumped together. They're called full thickness burns, and they sometimes involve the fat, the muscle, and the bone. And these are extensive. You don't see as much pain initially with these because there aren't nerve endings. They're gone. And I've got some pretty good pictures coming up of those. So the picture on the board right now, what's that? What is that? Or superficial partial thickness. It just affects the epidermis, right? First degree burn, superficial partial thickness, caused by heat injury to the upper third of the dermis and the epidermis. Nerve endings are exposed, the pain sensation is increased. Any sensation is painful. Everybody's had a burn. Touch or temperature change included. So if you forget you've got a little burn on your hand, you did it a couple hours ago, you go to the sink and wash your hands in hot water. It was feeling pretty good. Now what's it do? It's hurting again. So a lot of times, first and second degree burns, you're going to need analgesics, sometimes even opioids, sometimes non-opioids. Typically, they'll heal within 10 to 21 days without a scar. Sometimes you'll have some minor pigment changes that you'll see with first degree or superficial partial thickness burns. If I'm going too quick, you all let me know, okay? We got a lot of content to cover. First degree burns. What will you typically see? Again, red, moist, blanched. Now, is that a first degree burn right there? I think it's got a combination of the two. You see some blisters there. You see the redness. I do see some first degree burns, but I also see some second degree burns because I see blistering. You see the difference? With a first degree, you're going to have minimal edema, some thick-walled fluid-filled vesicles. The second degree burns are deeper into the dermis. Fewer healthy cells remain. I think I might have screwed up here, Crystal. Blisters do not form for second degree burns. I think I might have a typo.
Blisters do form in second.
Yeah, I need that. You all strike that knot out, okay? Blisters do not form for first degree burns. I guess I didn't edit it quite as well as I thought I did. Dead tissue sticks to underlying tissue. The skin surface is red and dry with some white areas in the deeper parts. Edema is moderate. You see some swelling on both of those pictures. Less pain than superficial. They can increase to full thickness if damage increases because of infection, hypoxia, or ischemia. So you can have worsening burns. I guess I didn't really know that until I read up on this. And these usually heal within 3 to 6 weeks. But you'll usually have scars from these burns. So I'm going to review that. Do second degree burns have blisters? Yes. What about first degree burns? Okay. Sorry about that. We may find more of that. Let's move on to third and fourth degree burns. Full thickness.
You have a question?
Yes.
In first degree, you mentioned, I think, the edema.
Just minimal. You'll see just a tiny bit of edema. Whereas if you go to second degree, you're going to see moderate edema. It's going to be worsening. And you may not even see a lot with a first degree burn.
The verbiage that I want you to get used to is superficial is first degree, right? Second degree has 2 types, superficial partial thickness and superficial deep partial thickness. So for testing purposes and your knowledge-based purposes, first degree, reddened surface. Second degree can't have particulate blisters, just like she said.
Yes.
So, for first degree, it's going to be very painful because there's still nerve endings.
Mm-hmm.
Second degree, is there a difference between like the deep partial thickness and the, as far as the nerve endings go?
The deeper the burn, the less pain you're going to eventually feel because your nerve.
Second degree burn.
Painful.
But
most of them are painful.
okay, but it does say less pain because the nerve endings have been destroyed.
As the injury becomes deeper, the nerves are destroyed, the pain goes away, except for the outside.
So a
when you
second
guys
degree
do
can be
here,
deep enough to destroy the nerve endings.
second degree is getting deep enough to destroy the nerve endings.
Yes.
Correct.
Yes.
Third degree, they're completely destroyed.
They're gone. So destruction of the entire epidermis and dermis, leaving no skin cells to repopulate. There is no regrowth for third and fourth degree burns. There's nothing left to regrow. Areas are not closed by wound constriction. Areas that aren't closed by wound constriction require skin grafting. We're going to go over that in detail later. You're going to see a hard, dry, leathery eschar. It's a hard, kind of a crusty looking black scab a lot of times. You see this here. And for healing and grafting to occur, the eschar must be removed. That's dead skin there. That's pretty rough looking, isn't it? These burns extend into underlying tissues and the fascia, which is a thin sheath that encloses muscle and organs. There's damage to muscles, bones, tendons, leaving them often exposed. You can get these types of burns from from flame, electrical, or chemical injuries. These are full thickness. They appear blackened and depressed with sensation absent. And they require excision and grafting early on. Grafting actually decreases the pain and length of stay. And with extremities that have burns like this, they sometimes require amputations. And we're going to go over that long. See that incision that goes down that arm right there? We're going to talk about that.
So for third and fourth degree burns, pretty much we get the eschar off as fast as possible and graft on as fast as
As soon as you can graft, yeah. You've got to get that old dried scab eschar off. If it's circumferential, goes all the way around a body part, like an arm or a leg or a chest wall, the back and chest. An eschorotomy, which is an incision through the full thickness dead tissue, or a fasciotomy may be necessary because that dead tissue forms some type of a tourniquet effect because of the swelling. So there's a tightening with that tissue. There's no elasticity at all. So we're going to go back and look at that picture. See how that could be all constrictive down here at the bottom. And there'd be, it would constrict blood flow to that extremity. And I mean, the extremity would eventually die if you don't get blood flow to it. So to release that tourniquet effect on there, they actually make just an incision down through that area. Now think about that. So if you're going to constrict blood flow to an extremity, if it's a chest and a back? What could that affect? We're going to get to it, but think about how breathing. Exactly. So if it's a tourniquet effect on your chest, I mean, you couldn't maybe get a deep breath, and then compound that with maybe upper airway injury. It gets kind of hairy. These burns may appear waxy white, deep red, yellow, brown, or black. Again, sensation is diminished or absent with these burns. Healing time depends on establishing a good blood supply in the damaged areas. Can range from weeks to months. So again, with this question, the sooner the better. You've got to get blood flow to these areas. Common problems with third and fourth degree burns or full thickness burns are impaired mobility, especially with extreme, like legs, imbalanced nutrition, infection, and self-care issues. So we've talked about the first classification of burn injuries, which is depth of burns. We've talked about first, second, third, and fourth degree burns. What are first degree burns called again? Superficial. And second degree? And then third and fourth degree. Full thickness. Great. So, second degree, everybody again, what second degree burns? Say it louder. Partial, superficial, partial deep. So the second classification is the extent of the burn.